Today we're talking about COVID-19 and communities of color. City Councilman Herb Wesson has recently released an informative new video that talks about who can be hurt if we reopen LA too quickly.
People have demanded their freedom. Freedom to go to the beach, freedom to get a haircut without any regard for the people who will be most affected by this. A long history of unequal access to health care has left Black, Latino, and the working poor in a position to be disproportionately killed by this virus.
Joining us now is Councilman Wesson. Thank you so much for being here.
It's a pleasure to be here with you.
Excellent. Well, tell us about this video and why you made it.
I think that in this business, the most important thing that we can do as public servants are to push and create conversations. It is important that we reopen, but we need to do it in a very smart and informed way. So I want to ensure that we are talking about this, the effects of reopening.
Let's talk about some of the reasons behind this.
The science is what drives us. And the science indicate that individuals that have pre-existing conditions are more at risk. And when you look at certain communities of color, you see that there are hypertension, obesity, diabetes. I guess that could be attributed to a broken public health care system that doesn't do a very good job where it relates to communities of color. And so we need to talk about all of this when we're talking about reopening.
What would you say to those protesters?
I get it. You know, most of them are good people and they want their freedoms, and God bless you. This is something that we in this country have never ever experienced before. It's nothing wrong with us beginning to reopen, but everything needs to be based on science, needs to be based on medicine. And I don't believe that any of the protesters want to be in a position because of their actions where they make somebody else sick. So we all want to reopen. Why don't we come together and come up with a common sense plan to do it that minimizes individuals at risk?
Well, Councilman, thank you so much for coming in to discuss this very serious issue with us.